All right, let's talk about something that matters every single shift: how you prepare and dress for work in healthcare. Whether you're new to care or you've been doing this for years, sticking to policies and protocols isn't just about ticking boxes. It's about keeping yourself, your colleagues, and those you care for safe. So first up, preparing for work. Before I even step into the building, I make sure I'm dressed according to my workplace policy. Clean, freshly laundered uniform, scrubs, no personal clothing peeking out, no dangling jewelry, no long, painted nails, no heavy makeup. Why? Because these things can harbor germs and make proper hand hygiene impossible. Now, dressing for work isn't just about looking professional. It's about infection prevention. If my uniform gets soiled, I change it straight away. I always keep a spare set handy. Speaking of hygiene, let's talk about hand cleansing. I always wash my hands or use alcohol gel before and after every patient contact, after removing gloves, after touching anything potentially contaminated, before eating or touching my face. Local policy might have extra steps, so always check your workplace guidance. Professional appearance matters. It's about building trust with patients and showing respect for the job. That's why I leave fashion accessories at home and follow the dress code to the letter. Now let's talk PPE. Gloves and aprons, synthetic, non-powdered, unsterile, are my go-to for most care tasks. If there's a risk of splashing blood, if there's a risk of splashing body fluids, if there's a risk of aerosols, for radiation risk I use lead aprons or whatever's specified. Sometimes PPE isn't up to scratch. Maybe it's damaged, out of date, or doesn't fit right. If that happens, I stop and get a replacement straight away. If I notice stock's running low, I report it immediately. There's no room for "I'll do it later" when safety's on the line. So remember, stick to your workplace's policies, keep your appearance professional, practice good hand hygiene, use PPE correctly, speak up if something's not right.